that way I can move out to the side.
Oh, okay. Okay. Yeah, we trapped you last
Hi, everybody. Thank you for coming to the, seems to be the recurring 4 o'clock press conference, but I'm Mayor Laura Hoydick for the town of Stratford, and with me is Health Director Andrea Bosman and Dr. Janet Robinson from the Stratford Public Schools, Public Safety Director Larry Ciccarelli, and Public Nurse Bernice, who I call Bernie, Bova. So we're going to start. We have been working today with the community on a variety of things, and we are going to start this afternoon by having Andrea give us an update.
Great. Thank you. Good afternoon. My name is Andrea Boisveen, and I'm the Director of Health for the town of Stratford. On Wednesday, State Epidemiologist Matt Carter talked about how we now have community-wide transmission of COVID-19 in southwestern Connecticut. And we spoke to you on our Tuesday conference that it wasn't a matter of if, it was a matter of when, and when is now. As promised, we said that we would come to you with information regarding our student at Wilcoxon School, and we received information today from the State Health Department that our student is positive for COVID-19. When we found this information out, we immediately informed the mayor and the superintendent. We worked with the State Health Department to determine what the next steps were for contact investigation. We are asking that all students and staff who work or attend Wilcoxon Elementary School to remain home to self-monitor for the next 14 days. At this point, this does not apply to the other schools. We've provided instructions to all employees and students at the school. A packet was sent out by email earlier, and that information is also available on our website. Those who impacted will need to monitor their temperatures and signs for illness for the next 14 days. And of course, if any symptoms arise, absolutely connect with healthcare providers if you're showing signs of illness. Our big message is that to stay at home, particularly if you have symptoms. We are asking about managing or doing self-management. Please keep in mind that this does not apply to household members of Wilcoxon students who are not ill at this time. So if you have a husband and wife who the wife is a teacher at Wilcoxon, the husband is still allowed to be able to go on, but the family needs to monitor all of those in the household. We chose, this contact investigation was very complex, and we worked hand in glove with our colleague, Dr. Janet Robinson and her staff, and we made a joint decision to close all the schools out of an abundance of caution, and I'm going to leave it over to Dr. Robinson.
Okay, thank you. Thank you. We have worked hand in glove with the health department. We really could not have done this without their expertise, help, and compassion. So we are doing what we can to help them in their contact tracing and see which other people may have been in contact with this young person. But additionally, as we discussed this, we became very aware how intertwined our families are. We are as a small town, and the families know one another, and there were other children who had been with the children of this family at other events, and it soon became very clear, even though we had no other symptomology anywhere in the district, that it was best for prevention in an abundance of caution that we cancel school so everyone can have the opportunity to not be in a petri dish, so to speak, of the schools. And so we feel this is the best action to take at this time to keep all of our students and our families at home safe. And as some of you may have heard, the governor has waived the 180-day rule. We had previously submitted a waiver that we would do distance learning during this time, so we will be finding out shortly what the requirements will be so that we can continue to educate all of our children over the course of time that they need to be out. Thank you.
Does anyone have any questions?
Are any other residents symptomatic or quarantined, to your knowledge? Any other Stratford residents or
We don't, I know, we're juggling back and forth. We don't have that, we don't have any information right now. I think what's really important is that the state epidemiologist, in saying that we have community-wide transmission, if you have those symptoms of fever, cough, shortness of breath, you know what? You probably have COVID-19. It's here, and that, you know, our messaging is going to be changing, that it's not about getting tested and doing contact tracing. You know, we have been, you know, stretched to the max, both we and the state health department staff, in terms of trying to, you know, figure out where all this is. It's here and now, and so our messaging is going to be, you know, if you're sick, stay at home. Use, you know, good common sense judgment. Wash your hands, like Mom said, wash your hands, and when you're done, do it again. You know, I think, yeah. So.
Is this the first child to have COVID-19 in Connecticut?
I don't have that answer.
You know, this is such a rapidly evolving situation. I've heard there are other cases that just got released, but as best as I know, you know, you had the 3 other cases, and they were over 60, I think, yeah. So yes, I believe this is the first student.
Go ahead.
How old is the student?
You know what? So a lot of what we do in local public health, we're bound by HIPAA protection, and you know, we're just referring to this as a student.
Do you know how the student made contact with the virus?
Yes, we do. The student had contact with someone who was positive for COVID-19.
I know you can't tell us the age or gender, but can you tell us how that student is doing? Are they expected to be okay?
I might have to ask to Bernie. I don't. You know.
I can say the student is currently recovering at home.
The student is currently recovering at home, and you know what? Our hearts and you know, prayers go out to that. And it's, you know, I'm sure it's been a wild ride, and not a good one, you know, for the family. So.
The Wilcoxon students and staff, does that constitute a quarantine, that 14 days at home?
Bernie, you want to address that?
Good afternoon. Yes, this is what we're looking at, is all of the students, staff, faculty, custodians, anybody within Wilcoxon School should remain home at this point in time, and they should be self-monitoring for the next 14 days.
We just gave out a packet of information, and that has how to take your temperature, making sure you use the thermometer correctly, and a 14-day log, you know, taking your temperatures morning and night, and looking, you know, asking yourself, this is what we were doing when we were monitoring travelers from the foreign countries, asking them, do you have a cough? Do you have a fever? Do you have shortness of breath?
Sore throat. Malaise or fatigue, those muscle aches and pains, that kind of stuff. That's all on there, so they have those symptoms. And anybody who does have those symptoms should be contacting their private physicians at this point in time. You want to talk to your doctor about your medical history, the signs that you're showing, and work out a plan with your doctor as to what the care should be at home and at what point in time your doctor wants you to go to the hospital. We've also included in that packet emergency contact information, as well as to look at if I am going to the hospital. If it's non-emergent and I may be going by car, I'm going to notify the hospital when I get there that I've been on 14-day monitoring. If I am going via EMS because my condition has gotten so gravely ill at this point in time, I need to notify EMS when I am calling that I've been on 14-day monitoring. This way our EMS and first responders can properly be prepared.
I hesitate to give all that personal information at this point. I hope you understand, but we're also thinking about the family and the Wilcoxon family too.
How long do you intend to keep schools closed?
Well, we're hoping that we will be able to, 14 to 17 calendar days is what we're speaking to. We're hoping that we can get open very quickly at that time, and everyone will be healthy.
Are you going to do any kind of distance learning in spite of the waiver process getting waived is what it sounds like happened?
I'm not sure what the requirement's going to be on that 180-day waiving. That's what I'll learn shortly in the conference call. But we did submit an application which included our our plan for our distance learning. Teachers have spent a lot of time coming up with their lessons. I was very impressed with the work they did and what they have to offer students. It's very thoughtful. So we will be beginning that on Monday.
How will you be doing the distance learning? Is it online or?
It's a combination. Our students from about from third grade up have Chromebooks, and so they can use those. We also have some packets that were given out to the younger children. We also have certain things that the kids do on a regular basis that they will just continue. For example, the reading protocols. They are very independent about doing their reading protocols. So we have a lot of things that will be a combination. The teachers will be in contact with their students every day.
So you guys are closing the schools, or you're going to be closing down the job site here too with it?
There's no reason to.
You're talking about the job site for Stratford High School? So it's run by a private endeavor. It's not it's our project, meaning that we are paying, meaning we're paying for it, but it's not under our control. That job site, as you know, if you work for a construction company, once it's turned over to a general contractor, they're in charge of that job site.
So,
Is the town making any adjustments as far as places that children may frequent, like the library? I know that other towns have shut down their public libraries and different facilities that are run by the town.
Yeah, we are. Would you mind, if you have questions for the superintendent, because she has to get to this conference call, how about if we direct the questions to her, and then Andrew and I can stick around, or maybe Andrew,
I can.
we can stick around, and is it all right?
Yeah, that's
So
great.
you anybody have any superintendent questions?
The decision to shut down the other schools aside from the
Mainly for prevention. You know, there's many of these families that have very vulnerable family members at home. If students are exposed and come home with these things, it will be very, very hard on the family. But the families were so intertwined, and we kept getting emails from people who said they had carpooled, they had been at different functions, and they had children at other schools. And so as we began looking at the quantity of those, we said, let's be safe, and let's keep them safe.
Do you have a sense of how many people are going to have to self-monitor from the local community?
Well, it's the entire population, which off the top of my head, I can't recall the number, but it must be about 300 plus, okay, in terms of children, and then the teachers, paraprofessionals, secretaries, other people there. Okay.
Clear that those people's families, if they're not symptomatic, don't have to isolate themselves.
I leave that to the experts.
And those students will still start distance learning Monday.
Yes. Thank you very much. I'm going to look for some explanations for our 180 days on my conference call, so thank you very much.
So back to your question. What could you say it again? Thanks.
So other facilities that students in Stratford schools may frequent, like the library, I know
Okay.
the towns have shut down the library, even the senior center, and the volunteer programs that involve children. I know seniors are also, vulnerable. I mean, are you shutting down those facilities as well, senior centers, libraries? Can you kind of speak to that?
Yes. So the library postponed or canceled all of their extended programs, and then they will follow the school protocol of closing down. They will be operational, meaning the staff will be there, but the doors just will not be open to the public. However, and I want to talk about this across the board, especially for town services, we have a lot of services that are online. Our staff will be available to answer telephone calls, so if you don't have to come here, maybe you don't want to come here, but we'll pick up the phone and we'll answer your calls, and we'll answer your emails. There are some things you may have to do and you may have to come in, but if we can push it off or delay it until we get over this hump, hopefully the hump is short, but that's what we're doing.
What about, to that question, what about the senior center?
So we closed it all.
So we closed the CARES program. We canceled activities, and this is kind of a rolling agenda. I'm pretty sure that we close it, I think, at the end of today, but I would have to double check. But to the point, it's a vulnerable population, and we're closing that.
So we didn't close the CARES program, which is our adult daycare. We are. That's not opening tomorrow. But we do feeding programs in the schools and also at our seniors center. So what we're doing, we mobilized today with our community partners to figure out how best to afford the community the services that they need. And some of those, like we do in the summer, which is these to-go lunches, box lunches. So these are the things that we're looking at putting in place, talking to our vendors and seeing the best way that we can accommodate those at home without bringing masses of people into one place together, but we can still provide the food services or the essential services that they need.
Are you in touch with the food bank or anything like that?
Yeah.
For students that, there are some students out there that when they go to school, that's the only meal they receive. So are you in
Yep.
touch with food banks to make sure that they're able to eat too?
So you're absolutely right. So we have 6 food pantries in Stratford. So and a feeding opportunity with Lord's Kitchen at a community meal. We also do the backpacks home for the weekend. So a student will take a backpack and it'll have the food for the weekend. So they will have an opportunity, especially if they're used to having breakfast and lunch provided for them at school, and when they go home on the weekend, they don't have the same opportunity. That's why we do that. So these are all the things that we're looking at of how to provide these services for our residents here.
Just to clarify, is the Baldwin Center closed or not?
The Baldwin Center is not closed, but the programs are closed, and the CARES program is closed tomorrow.
I know you said the student is recovering at home now. Were they initially treated at a hospital, and so is this sort of a sign at least that the student is getting better in their recovery?
I'm gonna refer, I don't know.
And just understand, I'm trying so hard to maintain HIPAA. I can tell you that that student was properly assessed within the system and had properly had a specimen sent to the state lab. And that's what gave us our final word that this child was positive.
What is the status of the person who came in contact with a student who had COVID-19? What's the status of that person?
So they're not in our jurisdiction, so I'm not privy to that information.
Were they an employee of the school?
Well, they weren't a Stratford resident, so I don't have,
They weren't employees.
right, no, they were not, they're not an employee of the school.
Are they a Connecticut resident?
Yes.
Was it the New Canaan case?
Once again, we are not at liberty to connect the dots as where you're going with this. So what I'm trying to say is that we have a list of patients that have been confirmed that have been positive at the state level. That's all I can tell you at this point in time.
What about town meetings? There are land use hearings, budget workshops scheduled, those being put off?
So if it's not essential, then we're asking that the chairman delay or postpone. For example, we had an architectural review board meeting. The chairman agreed to postpone that or to cancel this meeting. However, we are under state statute required to have Board of Assessment Appeals hearings. So those will be going on, but we are doing our best not to have large groups in this area. And so traditionally they meet with a commissioner. So it'll be the resident and a commissioner 6 feet away from each other. So we do the social distancing and in separate rooms so we can keep the protocols alive, or Andrea will have my head.
And town halls can remain open, just encourage people to do stuff online.
Yes, town hall will remain open. We're very conscious of protecting our staff as well because it's a public building. So we ask, if the public is sick, please don't come in. Please, take care of yourself at home, whether you have a flu, the colds, or COVID, and try to use online services as much. And if you can't, then we'll make accommodations for you to come in.
What about youth sports, extracurricular activities like scouting, scouts or youth sports? What's the status?
So Scouts is a good question. We didn't meet with any scouting groups today, but we met with the Recreation Department, Sterling House, the YMCA, and they've agreed to postpone all of their youth activities. Flag football, PAL, those kind of things. Okay, great. Thank you all.